Imagine this. You're lying on a table. 3 people are holding you down. The surgeon has already taken out a knife. And the worst part, you're fully conscious. No pain relief, no anesthesia. Just 200 years ago, this was normal. Today, I'll show you how people managed to survive in such a system of medicine, and why surgeons back then looked more like executioners. And the strangest part, this isn't the Middle Ages. This was happening as late as the mid-19th century. Yes, universities, science, and even hospitals already existed, but pain was still part of treatment. Surgery was a last resort. It was only used when a person was on the brink of death, because an operation almost always meant one thing: suffering, and the risk of not surviving it at all. People didn't fear the disease, they feared the doctor. But people still tried to reduce the pain. Before surgery, patients were given alcohol, sometimes to the point of complete intoxication. They used plants, opium, mandrake, henbane. They could dull the pain, but were often more dangerous than the operation itself. They also used sleeping mixtures. People inhaled herbal vapors to fall into a semi-conscious state. The problem was that it worked unpredictably. You might fall asleep or remain conscious and feel everything. When that wasn't enough, doctors went further. They used cold, ice, and snow. They compressed nerves and blood vessels. Sometimes they even pushed patients to the point of fainting. The goal was simple: reduce the pain at any cost, or at least make it shorter. Now imagine the operation itself. The patient is placed on a table. Several people hold their arms and legs. No sterility. No modern conditions. And the main rule for a surgeon: speed. Every extra second means pain, shock, and the risk of death. Some surgeons push speed to the limit. Amputations could be done in just minutes. It sounds like skill, but often led to mistakes. Healthy tissue was damaged. Bleeding wasn't stopped in time. And even if the operation was successful, it wasn't over yet. After the operation came a real gamble. There were no antibiotics, no understanding of germs. Instruments were used again and again, and without sterilization. Wounds became inflamed. Infections began. And often, people didn't die from the disease, but from the treatment. That's why many endured the pain until the very end, just to avoid the operating table. Over time, fear of surgery became almost legendary. People delayed treatment, hid their illnesses, because surgery wasn't seen as help, but as a trial you still had to survive. The doctor was the last hope, and the greatest fear. And then in the mid-19th century, everything changed. In 1846, American dentist William Morton publicly performed a surgery using ether for the first time. The patient fell asleep and felt no pain. At the time, it seemed like magic. At first, many doctors didn't believe it. Some thought it was dangerous. But the results were undeniable. Operations became longer, but more precise. It became possible to treat what was once considered impossible. And from that moment on, surgery began to look like what we know today. With the arrival of anesthesia, medicine changed forever. Surgeons no longer rushed. They began to work with precision. Complex operations became possible, less pain, and greater chances of survival. Treatment was no longer torture. Today, pain relief seems like something ordinary. But not long ago, people went through surgery fully conscious, without protection from pain, without guarantees of survival. And if you think about it, we live in one of the safest times in the history of medicine. The only question is, would you have agreed to be treated back then? We live in a world where pain can be turned off. But history remembers a time when that was impossible. Subscribe, and you'll see how our world truly changed.